Hi, Dr. Todd Snyder here, and in this 7th episode on smile design, we're going to discuss microaesthetics. Now, the area of microaesthetics, in my opinion, is what makes restorations of any kind, whether it be composite bonding, ceramic veneers, porcelain crowns and bridges, or implants, believable. Okay? So the anatomy, the texture, in my mind, makes things look believable in their appearance or artificial in their appearance. Primary anatomy and secondary anatomy are the key to believability in a restoration. And also, it's what allows the light to reflect asymmetrically, creating an illusion of being a real tooth as opposed to a picket fence, right? Sometimes it's easier to evaluate when you can change a color photograph to a black and white or grayscale image so that your colors aren't distracting your eyes. So where you have an image like this, you can see teeth are fairly smooth, but obviously it's distracting as far as the colors. And so looking at a black and white or grayscale image oftentimes can allow you to see more of the actual texture where you're eliminating a lot of the color that your eye is perceiving. Okay? Now, you can see in this next image of the patient's anterior right quadrant that there's virtually no texture, along with virtually no color change in the teeth. And although many patients want this type of appearance, it's not something we as dentists would typically see in a real tooth or on a younger individual. However, the shape, the development of that shape and the increasing width of the incisal embrasures and the shrinking contact point between the teeth certainly help carry the case to be believable to most people, right? So it looks believable to some extent, but obviously because of the lack of texture, it looks a little bit artificial to a dentist. Now, in this next case, there's some larger development of the lobing or primary anatomy, as well as some more natural color transitions and translucency. Now, all of these together combine to create more realistic looking teeth. Right? So you've got a little more primary anatomy in the teeth to make it look a little more believable. Now, in the next case, we can see we have more asymmetries in the actual texture. These subtle nuances of primary anatomy with the lobing along with secondary anatomy texture or pericomata and other little things that are added in to give it a natural appearance. We can add in maverick colors, translucencies, etc. All of these slight imperfections, trying to make things not perfect in the incisal edge and the facial aspect of the teeth, create a definite realism that the other two cases obviously were lacking. So again, asymmetries often create a more realistic appearance. And at the end of the day, the case really depends on what each patient is wanting in their final appearance. So even if we create what we as dentists believe to be the perfect smile design because of all the metrics we've talked about, that we put behind kind of these ideal smiles as dentists often do, I've had patients that didn't want that type of appearance, that they wanted the, let's say, ridiculously white teeth, the ridiculously perfect symmetric teeth. They wanted to have everything the same length, which in my mind is a worn dentition. But they wanted all this perfection and smooth teeth because their perception through social media and other areas of influence have made many of these people believe that that's what's desirable. And so that's what they want. So everyone has a different desire. So instead of trying to create our level of perfection within the dental community, sometimes it's good to get the patient's input such that you can create what they want. Stay tuned for the final episode on smile design tips and occlusion.